Kolcaba's Comfort Theory and Peplo's Theory of Interpersonal Relationship by Vicky Ido. So, what is nursing theory? Nursing theory is defined by Millis as a conceptualization of some aspect of nursing reality communicated for the purpose of describing phenomena, explaining relationship between phenomena, predicting consequences, or prescribing nursing care. From the development of classic nursing theories that started with Florence Nightingale's theory of environment to the emergence of contemporary nursing theories, nurses have acquired nursing theory knowledge that has subconsciously or knowingly informed their practice. The application of nursing theory to practice is paramount in the nursing profession, and several articles have been written to further delineate these theories and augment nursing knowledge. Nurse scholars agree that nurses utilize some form of nursing theory or conceptual model in daily practice, and they propose that nursing theory is vital to nursing existence. Given the range of nursing theories available to nurses, it is imperative for nurses at each patient's encounter to carefully choose a theory that is meaningful and one that will produce the best outcome for their patients. Now, let's look at a practice scenario. Mr. Doe is a 65-year-old male who presented to the emergency department with a 4-day history of increasing abdominal distension associated with abdominal pain and fullness. According to Mr. Doe, he developed nausea and vomiting and marked abdominal distension within the last 24 hours. He had not passed gas or had a bowel movement for 4 days. On examination, Mr. Doe was anxious and dyspneic. His oxygen saturation was 87% on room air. His abdomen was soft and quite distended and tympanic with percussion. Liver, kidney, and spleen were not palpable. He had a history of hypertension, obesity, and osteoarthritis. CAT scan revealed a focal right lower quadrant spergillion involving a loop of large bowel with secondary proximal obstruction, and he was placed on the surgical list for small bowel obstruction. Now we will apply Kolcaba comfort theory. Here are some definitions that you need to know. Mr. Doe experiences comfort in the relief sense as interventions were carried out to promote comfort. NG2 was inserted, pain medication was given, antiemetic medication also given. He experienced comfort in the E sense as the issue causing anxiety and discomfort were addressed. Kolcaba mentioned that as patients become comfortable, they engage more fully in health-seeking behavior. Hence, Mr. Doe was able to rise above his challenges. He attained comfort in the transcendent sense when he became fully engaged in his care and started asking questions about his upcoming bowel obstruction surgery. Now, let's apply Peplo's theory. To the left of me is the definition of Peplo's theory. The orientation phase is the initial stage during which the patient has health-seeking behaviors, and this period set the stage for a more trusting relationship. For Mr. Doe, the nurse began the orientation phase by introducing herself and establishing her role as the nurse. She then proceeded to collect Mr. Doe's data by asking relevant questions, assessing his pain level, obtaining his vital signs, and addressing his anxiety level. The working phase is an important period where the patient identifies the nurse as consistently helping, providing unconditional care, and providing empathy. For Mr. Doe, the nurse administered medication as ordered to alleviate pain, anxiety, and to promote comfort. The nurse continued to carry out doctor's order and at the same time ensure that Mr. Doe remained comfortable. During the working phase, power shifts away from the nurse to the patient as the patient becomes more independent with personal care. As Mr. Doe became comfortable, he began to participate in personal care and showed interest in health outcomes. Lastly, The termination phase allowed the nurse and the patient to disengage from nurse-patient relationship altogether. At the termination stage, Mr. Doe was stable enough to be transferred to the surgical ward. The nurse addressed Mr. Doe's concerns, summarized the discharge plan for the emergency department, and gave report to the surgical ward nurse for continuity of care. Here are the similarities between Kolcaba theory and Pepler's theory. Notice how both theories promote enhanced comfort for patients using a patient-centered care approach. Take a look at the differences between both theories. Nursing theories are quintessential to nursing practice. My philosophy of nursing is underpinned by a patient-centered approach to care, where the patient's need is my first priority. Thus, I frequently apply the Kolcaba comfort theory and Pepler's theory of interpersonal relationship to my nursing practice. Nursing theories are inextricably linked to nursing practices. Consequently, I've found that my nursing practice cannot exist without theories.